There is an outbreak of measles in Minnesota with cases spiking in Hennepin County. And now the Minnesota Department of Health is putting out new guidance on measles vaccinations. Fox 9's Rob Olson joining us now. Rob, MDH is telling people to get updated shots as soon as possible.
Yeah, a second dose can come very, very quickly. Typically, the measles vaccine, which is part of the MMR, is given about 3 years apart in children. The new guidance from the Department of Health is that you can get that second dose as soon as a month after the first one to get those children fully vaccinated in light of this outbreak. Now, there have been 11 new measles cases reported in September. Now, it's been over 2 weeks since the last one, but there have been lulls like that throughout the outbreak, and doctors say there's no reason to believe that we're in the clear anytime soon.
We have been dealing with this for quite a long time, particularly because of the long incubation period of measles.
The measles outbreak in Minnesota began in May and picked up steam as we got into August. While there's not been a new case now since mid-September, for pediatricians, nowhere near long enough to feel it might be slowing.
Or people who are potentially exposed to measles can develop symptoms up to 21 days afterwards. So it's really hard to say when we're in the midst of the outbreak when it could end or if we're close to the end.
To date, 51 confirmed measles cases from the outbreak in Minnesota this year, 50 of those in unvaccinated children. 8 additional cases are unrelated to the outbreak, such as exposure from travel. Most of the 51 outbreak cases, 45 of them, are in Hennepin County. 3 in Anoka, 2 in Ramsey, and 1 in Dakota. 24 cases in kids ages 1 to 5, 22 cases ages 5 to 19. The first dose of MMR is typically given at age 1, the second around age 4. New guidance from the Minnesota Department of Health is that second dose can actually come very quickly after the first.
You can get that second dose 28 days after that first initial dose, so kids are fully protected sooner.
The big issue doctors are dealing with measles is the fear of the immunization. Dr. Liz Plotchik says there should be no fear of having that discussion.
The biggest thing is to just ask the question, not feel like you're going to be judged by your pediatrician, but come in and ask us. We're open to having these conversations all day, every day.
And 12 kids have been hospitalized through this outbreak among all those cases. Now, the Minnesota Department of Health says this does remain a very high case number. In Minnesota's Somali community, the risk there remains very high, but stress, again, anybody that's not vaccinated or fully vaccinated does remain at risk. Live in St. Paul, Rob Olson, Fox 9.